Good afternoon, everyone, and welcome to today's webinar, Critical Steps to Addressing Social Isolation Through Housing, hosted by the National Housing Conference and sponsored by NeighborWorks America. My name is Brittany Webb, and I'm the Director of Research at NHC, and it has been my continuing privilege to help develop these webinars with our friends at NeighborWorks. We are thankful for NeighborWorks' partnership, which enables these webinars to be both widely available and incredibly valuable for our members and non-members alike. Today's webinar is number 9 in our series, and the topic is somewhat unique for us. Most of us in this industry are not medical doctors. We are advocates, developers, policymakers. But the discussion we're about to hear on how mental health and housing are connected is incredibly important for all of us. There's been a lot of research on how housing impacts overall health outcomes. NHC itself has published briefs in 2015 and 2019 highlighting the connections between health and housing. In fact, we kicked off this partnered series in 2022 with a webinar about bridging the gap between health and housing that discussed the social determinants of health and addressing the social needs of communities through healthcare and housing partnerships. But the idea of housing impacting mental health, not just physical health, is still being explored as we continue our understanding of mental health in general. As far back as 2000, there was a report from a previously existing Commission on Mental Health that found that the lack of decent, safe, affordable, and integrated housing is one of the most significant barriers to full participation in community life for people with mental illnesses, and noted that housing is often the first line of treatment for people with mental illnesses. Housing First models exemplify this concept, and their successes underscore that housing is the first step to helping our neighbors who are experiencing homelessness and the long-term impacts of being unhoused on their health. But these extreme cases are not the only considerations we should be making. Housing costs are inextricably linked to stress, anxiety, and depression for thousands of people across the nation. Too many of us have personal experience with the burdens of financial struggle, and too many worry about how they will make their monthly rent or mortgage payment and feel firsthand how that worry impacts them both physically and mentally. Our panelists today will explore the relationship between housing and health and the risks posed by social isolationism in communities, as well as strategies to help counter the impacts of social isolation and successful examples of addressing isolation through housing. They represent a range of organizations, including Build Healthy Places Network, St. Mary Development Corporation, AARP, and NeighborWorks America. We will be taking questions from attendees using the Q&A feature after panelist presentations. So please submit any questions you have for our panel through that Q&A function box, and we will consider that when we get to that portion. Our conversation today will be moderated by Romy Hall, the Director of Healthy Homes and Communities at NeighborWorks America. Romy?
Thanks so much, Brittany. Hi, good morning and good afternoon, everyone. I'm based in the West Coast, so good morning and good afternoon. As Brittany shared, I'm Romy Hall, and I'm the Director of Healthy Homes and Communities at NeighborWorks America. And I'm just really so excited to be amongst such an esteemed group of panelists to explore such a big topic as social isolation. Today, you'll hear from Ruth Thomas Squantz, the Co-Executive Director of the Build Healthy Places Network, Madeline Baker, the Senior Vice President and Chief Operating Officer of St. Mary Development Corporation based in Dayton, Ohio, and Dr. Rodney Harrell, who is the Housing Lead and Vice President of Family, Home, and Community for AARP. And before we have our panelists share about their dynamic work to address social isolation in communities across the country, I'm going to share a little bit of framing about NeighborWorks America and about social isolation. So if we can have the slides come up. And the next slide, please. So if you're not aware, NeighborWorks America is a congressionally sponsored organization that partners with a network of nearly 250 organizations in every state, geography, the District of Columbia, and Puerto Rico. Together with our network, we work to create opportunities for people to live in affordable homes, improve their lives, and strengthen their communities. The work of NeighborWorks America and our network is vast, from leveraging over $9 billion of investment, creating nearly 20,000 homeowners in over just last year, and a portfolio of over 200,000 rental homes, and supporting thousands of affordable housing and community development professionals access quality training and capacity building opportunities. Next slide. About a decade ago, NeighborWorks started an initiative recognizing the growing interest, alignment, and intersection of health and housing. Over this decade, About 70% of our network are implementing work at the intersection of health and housing, focusing on supporting their communities across the country become healthier and create more thriving opportunities for residents and places. Through our Healthy Homes and Communities work, we've provided a variety of capacity support to our network, and this has included peer learning opportunities and grants to connecting them to health capital investment opportunities and developing health measurement tools and evaluations. Next slide. And so social isolation, as Brittany shared in her opening, is that this is really becoming such a big topic in housing and community development. And it's really of the moment urgent in this discussion because it not only just impacts individuals, it also impacts our society as a whole. And in 2023, our Surgeon General, the Surgeon General released an advisory on social isolation named Our Epidemic of Loneliness and Isolation. This seems even more acutely important given the COVID-19 pandemic, where our separation literally kept us alive, but also isolated. And even though it may seem that social isolation was new because of COVID, it's been around for a while, and the effect of the pandemic has made it increasingly aware of the presence of social isolation. And really, at the heart of it, we as humans, as a species, we're wired for connection. The CDC, the Centers for Community Control and Prevention, has provided a definition of social isolation that's really focused on the lack of relationships with others and having little to no support. And that social isolation is really shaped by the access to social determinants of health or by the places where we live, learn, work, play, and even pray. And where you live, learn, work, play, and pray can shape it really then becomes it shapes how different certain groups have access or have are socially isolated, and particularly older adults, low-income individuals and households, people living alone, and people of color often experience more incidences of social isolation than others. And the really big piece is that sometimes we might think social isolation is in a container of an individual, but it really has an impact. And just alone in our US economy, $406 billion annually is missed from social isolation. And so moving to the next slide, at NeighborWorks, we've been hearing from our network and have been really curious about social isolation. And we've partnered with organizations like the Build Healthy Places Network that you'll hear more from Ruth in just a minute to develop materials and trainings on this topic. We also recently conducted a survey of a cross-section of Americans to learn more about social isolation. And some of the key results that came back illuminated what the CDC has shared about the negative impacts of social isolation. But it also highlighted some key areas where housing has a role in addressing social isolation. Our survey has illuminated the importance of friends, family, and neighbors as generating a sense of community. And that is really such a big anchor of the work of affordable housing and community development. And that housing is one of the primary ways, in addition to education opportunities, to develop social connections. And that to that point, specific housing initiatives have a big role to play in reducing social isolation and creating social connection, from organizing events to creating communal spaces to fostering opportunities for community cohesion, integrating arts and culture. All of this and more can create opportunities for connection. And often, just to say, the work that affordable housing and community developers do, in particular, to create critical access to services and amenities, are very important in creating opportunities for social connection and reducing social isolation. And so moving to the last panel, the last slide, this panel, we really hope to raise awareness of social isolation and provide you all a sense with the different ideas that go along and some resources. We also recognize that there are many strategies to address social isolation. There's just not one size fits all, and that we're going to be exploring what it looks like in cross-sector partnerships, targeted programs and services, community cohesion and engagement opportunities, as well as the broader community context around housing and livability. and that our panelists really have different perspectives and come from different contexts and approaches to hopefully support you in really building and understanding those critical steps to address and explore social isolation through housing and creating more opportunities for social connection. So with that, we're going to have Dr. Ruth Thomas Squantz, the co-executive director of Build Healthy Places Network, share a bit more.
Great, thank you so much, Romy. My first slide, wonderful. Hi, everybody, hope you can hear me clearly. My name is Ruth Thomas Squantz, and I am the co-executive director of Build Healthy Places Network. Next slide, please. And we are a national center that works at this junction between public health, community development, and healthcare. Excuse me. So there we focus on transforming the way these sectors work together to create community-centered investments that can advance racial equity and improve those social determinants of health that Romy referred to support health and well-being in all communities. Next slide. So in our work of seeking to achieve health equity, it really sort of forces us to set a goal of achieving health equity, forces us that we really want to think about what we mean by health. And then we have to begin to think about it beyond just the absence of disease, to think about thriving. And that really asks us to think about what are the factors that impact health outside of just the clinical delivery system. And as you have heard, people refer to the social determinants of health, describe these factors. So one framework that we have used that I will share to sort of set up this conversation that we're going to have today is called the 7 vital conditions for well-being that comes out of Rethink Health. And it really emphasizes in a simplified way what a multifaceted nature of other systems that we have that go to make up these social and physical environments and how they combine to impact health. So the factors here are grouped in 7 domains. They have indicators within them. So you'll have a domain, such as humane housing, a great self-explanatory section about that encompasses providing safe, stable places to live that create vibrant communities and neighborhoods that are safe from hazards. And just in thinking about that alone, you can already get a sort of sense how that could impact something like social isolation. So one thing I like about this framework is the way that it can support us in thinking about what are the levers we have available to us to sort of really create community change. And I think it can help to make sense of the connections around these factors that can connect things like housing, transportation, and social isolation and health. Next slide, please. So, and one more click. So in fact, these vital conditions, when they're disrupted and when they're not met, will result in people struggling. People struggle, people suffer, and then those demands will drive the demand for urgent services, way more expensive measures that lead to less resources in communities that results in their vulnerability in the face of something that's an unexpected crisis, just like COVID-19. So another way that we can also see it is that these factors are really not evenly distributed in all of the communities due to many of the race-based policies and practices that we've inherited and perpetuated. So these factors are spread differently between communities, and it's built into our systems. So then we begin to see differences in health outcomes and the health inequities that we know are disproportionately impacting on certain communities, communities of color and LGBTQ communities. So one more click. So one more thing that I like about this framework is that it is also built and centered around centering of people, that civic muscle and belonging. It's such an important part for this conversation, the idea and sense of belonging, and perhaps strange to sort of think about it as such a central role for health. but it lies at the heart of these vital conditions. And it really points, I think, to the importance of belonging, social connection, a sense of agency, shaping your environment and community and being part of that, and how that supports health. And it's also important, really points to how important it is as part of the process that we might adopt in the work that we're trying to create solutions. So we need to center people and community in defining the challenges, but also in defining and creating the solutions that we come up with in addressing those. Next slide. So we heard about the interconnections briefly between housing and social wellness and mental well-being, and these can really affect us across our life course. This is just one quick example of that connection with housing. In this study that was released from the MacArthur Foundation, they found that poor housing quality was the strongest predictor of emotional and behavioral problems in low-income children and youth. So just thinking about that, we've already talked about and suggested the central importance of housing and homes. And how does that affect in youth your education system, achievement gaps, and all other outcomes? Next slide, please. So as Romy said, social isolation is such a direct concern to health that it was the focus of the Surgeon General's report that referred to it in strong language as a public health crisis. And one background resource that is available on the BHPN Build Healthy Places website, buildhealthyplaces.org, but I can share it later, is this long form essay where we explored some of the issues around how to combat social isolation through cross-sector partnerships. So we know there's an intersection. Sorry, I'll start with, we know that there's this increased risk of disease, and there's a much quoted research project that's listed in that article where they measured that adding a rich and social network to someone had the equivalent impact on improving their health as quitting smoking. So it profoundly affects us physiologically when we interact with other people and our environments. Another feature of social isolation, if we go on the slide, is that we know that there's an intersection with mental health, that isolation can lead to cognitive decline, anxiety, mental illness, and that there's an intersection that those that have mental health challenges and anxiety can end up being socially isolated through our structures. We know it's also an equity issue. It's immigrants, LGBTQ individuals are more at risk of social isolation. Also communities of color, it's more prevalent. And we think about welcoming in white spaces, who is welcome to move in certain spaces and feel safe. And then finally, that point around the built environment and how isolation is really connected to sense of community safety. It's impacted by transportation, and I think we'll hear a little bit about that later today. And also that economic security, which allows you agency to be able to change your situation. Next slide. So the work that we do at BHPN points to a role of partnerships as a way to address these drivers of health inequities, such as social isolation. Next slide. So, and as I will show in some of the examples that you're going to hear from the other panelists the way later on, that this really takes looking upstream in this upstream approach to when you want to address issues like social isolation. You've got to reframe who is in the health partnership ecosystem. And as practitioners, it's an opportunity for you all to look at who are the people that are not at our table for talking about these issues. Where can we connect with community leaders, local governments, those in health sector, public health and healthcare, to really broaden our team of players that can come together to address this issue. Because as we've discussed, this issue cuts across different sectors. and it's cuts across our whole life. So in terms of wherever we interact with systems, we need to be able to bring those folks together to be able to determine the solutions. So I'll finish off with one more resource that can help us talk about this. And just before the pandemic, as Romy mentioned, we started a project with NeighborWorks America to create some fact sheets that could support community developers as they think about their role in health. And the subject matter, the ones we chose, were really in response to questions from NeighborWorks America members. And it was around how community development plays a role in addressing mental health, how it plays a role in preventing and ending homelessness. And the third one was counteracting social isolation. And little did we know, really, just how powerfully those three were going to rise in our sort of collective consciousness over the next few years as we went into the pandemic. Next slide. So again, I can share the link to the fact sheets. This is just an example of the fact sheet from that around counteracting social isolation. We explore some of the factors in housing realm that can contribute to social isolation, things such as redlining, discriminatory housing policies, gentrification and aging, which we'll hear about, and really discuss the role that housing can play in that. And when we'll also share in the fact sheet, you'll see some case studies of impact. That's always so important to see where people have come together to make those changes. And one example is I've mentioned here is this project that was supported by NeighborWorks America, where the community gardens in Springfield, Ohio, was a 50-unit senior living community that was designed to address the challenges of aging and isolation, things such as all the front porches and doors, focusing on a central area. So really thinking about connection and how it impacts isolation. Another aspect that we can share is that trauma-informed practices can help in addressing social isolation and supporting those suffering from anxiety and other mental health disorders. So again, creating that sense of space and place and how we intentionally bring those together with services, which we'll discuss later, is such an important part of that approach. Next slide. So this slide shows another resource on our website, which I can share, where I interviewed Carrie Henning-Smith, who's an assistant professor at the University of Minnesota School of Public Health. And there her work centers on rural health equity, including senior health. And it's really just a reminder for me to make that point that social isolation can be experienced as a major challenge in rural areas too. So I'll leave you with our website, and I think it's listed on here, and you can find me on LinkedIn. And thank you very much for your attention. I'm really excited to hand the mic over to Natalie Baker to introduce herself and tell us about the exciting work that they've got going on over there with St. Mary's. Thank you, Natalie.
Thank you very much. Good afternoon. So as Romy said, I'm Natalie Baker, and I'm the Chief Operations Officer at St. Mary Development. So just a little bit of background about St. Mary. St. Mary Development's been providing affordable housing and services for over 34 years. And over its history, St. Mary's developed 70 affordable apartment communities with nearly 5,000 housing units with $580 million in real estate investments. We also received the William J. Graves Ohio Housing Excellence Award for statewide leadership. We're core certified members, and we're a chartered member of NeighborWorks America and Leading Age. So we provide services in two ways. We develop affordable housing for seniors and provide wraparound social support through community health work, service coordination, and prevention services. And we do this through one-on-one meetings, evidence-based educations, and assessments. Next slide, please. So we collect a lot of data about the older adults we serve because we meet them in the communities in which they live. We've been tracking this data since before COVID, and the dynamics we found have been really shocking. So our residents have an average income of $14,350 a year. Many of the seniors are also identified as frail or at risk or need help with daily activities of living, but we're not assisted living. So these seniors are living independently in senior apartment communities with help of wraparound support. So most people assume that once a senior reaches a need for a higher level of care, that they would naturally transition to assisted living and then move on to a nursing home as their health declined. But that's simply not true. The average assisted living in Ohio runs around $60,000 a year and is not covered by Medicare. Keeping folks in their home longer with the help of layered services and wraparound supports going to be the only option for many communities and many families. Out of the 1,000 residents we serve in Southwest Ohio alone in the last 12 months, we've served 936 of them with one-on-one services and assessments during over 11,000 visits we had just last year. Of those 11,000 visits, 264 of them were for mental health issues. So with mental health issues, it could be maybe they need transportation to their provider, maybe they're trying to access treatment, or maybe they're in mental health crisis. In addition to the mental health concerns, we also had 71 visits where we connected our older adults to substance use resources. Prior to COVID, 21% of our seniors self-reported having mental health concerns. In 2024, 40% of our residents self-report having mental health concerns. Substance use is also on the rise. Prior to COVID, 3% of our seniors self-reported a substance or alcohol use issue. And today, 8% of our seniors report struggling. This is crucial because if you think about COVID, this is during the same time that virtual care has become commonplace. In-person appointments have wait times that exceed up to 3 months if you're not an established patient. In Ohio, opioid funding is drying up, so behavioral health clinics are cutting programming and services across the board. In addition, access to providers has become a challenge. Our local public transportation in Dayton, Ohio, is having staffing difficulties, so they cut the senior bus line. And we all know on-demand rides are becoming more and more costly. We really had no choice but to find a solution for our seniors that integrated health and housing with a special focus on mental health, prevention, and chronic disease. Next slide, please. So we've been able to do this work through intentional assessments, self-report surveys, on-site educations, and partnerships, like you heard about earlier, with local service providers. In 2023 alone, we brought in 660 educational programs. Some of these were evidence-based programming provided in-house by our staff, but many are offered by experts within the community, like a utility assistance program. It's beneficial to the senior because then they get to hear the information in person during a program and ask their neighbors if they didn't catch anything. But it's also beneficial to the provider. If the provider presents the information, 20 people, he's just handled 20 people have all received the same information. It's a lot more beneficial and time effective for him to do the program than have 20 individual seniors call him with information. So it's beneficial on both parts. It's about those networks and the relationships within the community. On the slide, you see that some of the programs to include our own WISE curriculum. So WISE is the Wellness Initiative for Senior Education. The WISE program educates older adults on a variety of topics, including safe medication use, the aging process, communicating effectively with healthcare providers, and strategies for making healthy lifestyle choices. The perk is this curriculum has actually allowed us to get a staff member 100% paid for through our local Adamus board, which, as you guys know, that's one of the biggest hurdles is how do you pay for it? Next slide, please. And one of the things that's really important to us is knowing how do we know what we're doing is working? We're always checking in with the seniors that we serve. So we do this in a few ways. Individual assessments, are the older adults we're serving having less issues or concerns? So some of the ways we do this is through the PHQ-9. It's a multi-purpose instrument for screening depression. The Lubin Social Networking Scale, it correlates mortality, hospitalization, health behaviors, depressive symptoms, and overall physical health. And the UCLA-3, it uses a 4-point Likert scale to measure loneliness. It's literally 3 questions. So it's not a complicated, you don't have to be a health professional to provide the assessment. It's really just 3 questions. Another way we gauge this is we look at program attendance. Are people attending the programs being offered? And if not, why? we found one of them, we had really low attendance, and we assumed it was would be a really popular program. We found out that the church across the street was doing a meal program at the same time. So maybe it's a timing issue. And lastly, one of the ways that we gather and collect resident feedback is in our annual resident survey. It also allows us to measure success. So what are the older adults saying? Sometimes we think we know what they want or need, but we really don't. Maybe everyone loves a local food pantry, and our assumption is that it's a lack of food. Can we bring a food program to them? Really, the problem is transportation. Maybe they just want transportation to the grocery store. We have been able to find a mobile grocery to come to some of our sites, but it's really asking the right questions instead of making the assumptions. I said it helps us measure success. So self-reported quality of life is our benchmark. So in 2023 alone, 84% of our seniors said they had a high or somewhat high quality of life. Considering that they're living on just over $14,000 a year with multiple chronic conditions, this is pretty huge. By using housing as the framework for the services we provide, we can not only remove many of the barriers the seniors face, but also improve their quality of life and improve social networks and reduce that isolation. The cost, like you heard earlier, reduces cost to Medicaid, it reduces cost to cities and communities, and it allows the seniors to age in place where they'd like to stay. Yeah, we'll talk a little bit more later about some of the in detail work, but I'm going to go ahead and pass it off to Dr. Rodney Harrell. Thank you.
Thank you so much. I'm really excited to be here and to join this panel on a really important conversation. I'm glad that we're gathered today, and I noticed in the chat that we got many people from a range of different disciplines, but a lot of housing folks in particular. And it's important as we address this topic because I think, and I've said for a long time, that the siloing of issues that we face, policy issues that we face, is perhaps the biggest policy challenge in America, that we have different sets of folks thinking solely within their discipline and not about how issues interact. So this intersection between health and housing is a crucial one. Now, by the way, before I jump in, I work for AARP, and you may not know AARP for our work on livable communities, but we've been in this space for a long time. Since our founding of our founder, Ethel Percy Andrus, finding one of her colleagues who was a retired teacher living in a chicken coop, who was certainly isolated and in a poor situation there back in the Depression. That's the founding story of AARP to today's work, where we're in every state across the country, working on a range of issues that impact older adults and their families, of course, including housing and livability. Ruth talked earlier about the health partnership ecosystem, and that's one thing that I want to think about as we talk about a livability approach here and the kinds of things that we do here at AARP. So first, let me ask this question on the next slide, which is the question I always ask when I talk to urban planners and others. Are we building communities with livability in mind? And the idea is that, this community here I took a picture of, 80% of neighborhoods in the country are single family home neighborhoods, according to our livability index. And I talk to older adults all across the country who perhaps bought a dream home at some point that served them well. Their family was raised there, their friends and neighbors were nearby, their religious institution or place they love to connect was all a place that they could get to all the time. But then what happens is they're unable to drive, or maybe their spouse passes, or their kids leave. And now this dream homes become a nightmare. So they can be stuck in a home that doesn't meet their needs. That's really a compromise that's challenging for so many reasons. But in this case, particularly the idea of social isolation. And so, speaking of social isolation, I'll go to my next slide and mention a study that we did before COVID back in 2017. that social isolation cost additional nearly $7 billion for the Medicaid system. And Medicare system. And the Medicare spent $134 more every month for every socially isolated older adult. And this was more than things like arthritis. It was almost as much as high blood pressure and some other conditions cost. And so, this is a signal of, of the need to take social isolation seriously. And one of the things that we can do to address that is really think about where we live and how we're connected to people and how that works together. Another thing that really spurred some of this work for us is the idea that during COVID, many of us faced social isolation for the first time. And frankly, one of the most isolated places are nursing homes. We know that people in nursing homes face loneliness at a rate twice as much as others did. And unfortunately, over 150,000 people died in nursing homes. And what that did is I think it triggered a understanding that we need to think more about our housing options and how they may limit us. And so we have heard from many more people about some of the housing options I'm going to talk to you about in a little while. Since that time, as just that intersection has really come into the crosshairs. So I mentioned the livable communities approach. On the next slide, I'll talk a little bit about what that is. So the idea of a livable, age-friendly community is one that's safe and secure and enhances personal independence through access to supportive community features and services, things like healthcare, reliable transportation, grocery stores, parks. The idea is that if you have all of these things and housing and transportation options to allow you to stay there, thrive there, and connect, you can stay in a community, you can live in a community, you can thrive in a community, you can connect in a community. So a livable or an age-friendly community is one for people of all ages. Now, I won't put another framework in front of you. We've got our own set of frameworks as well about the items that are in a livable community. I mentioned our livability index, which measures every neighborhood across the country across a range of factors. But the important thing to note is that every community decision is a compromise, that there's no perfect community for older adults. There's no perfect community with no chance of social isolation. There's no perfect community out there. And every one of these communities are a set of trade-offs and choices. And so every person faces those. So what I want to talk a little bit about for the next slides are some of the housing solutions that are part of our real focus on housing at ARP. This one, many of you who are urban planners or policy folks might be familiar with. The idea of missing middle housing is something that we're pushing in a great way across the country, and many communities are as well. So I mentioned that 80% of neighborhoods in the country only have single family housing. So that means that this missing middle housing, things like duplexes and triplexes, all those things you see in the middle of the table are missing, or they're, and frankly, zoning may not allow them. So that person who I've talked to, and many people I can think of specifically I've talked to who are isolated in those single family homes, might not be able to move to another housing option and stay in the neighborhood where they are. Right now, if there was something that they could downsize in, perhaps they could stay in that community. Maybe that's from an affordability standpoint, or maybe from its connection to others standpoint as well. So missing middle housing and creating more middle housing is one way to create more options in neighborhoods. But I mentioned all of the single family homes in the country. So on the next slide, I'll talk a little bit about accessory dwelling units, or ADUs. So accessory dwelling units are building a unit that's either attached to your home or detached, a separate living space that has a kitchen, bathroom, bedroom, a place that someone can stay. And this is a great housing option for me. As you can see here, by the way, that nearly 2/3 of people would consider building one of these for a loved one who needs care. And because they allow people to be more connected in existing neighborhoods. So someone who might be a caregiver to stay there to help them. Someone might need that to help them pay their rent, or to have some place to downsize in a community. But again, that's an option that can help people stay in the communities where they thrive and stay connected to some of the other community elements. It's crucially important for people to be in communities that are near parks and libraries and grocery stores and things where they can get perhaps healthy behaviors or food or things that may keep them healthy, but they're also important points of social connection. And ADUs are the best way to try to create more options in our existing communities. On the next slide, I'll talk about just a range of other housing solutions that we've looked at, things like co-housing, the idea of building purpose-built homes that bring together different people with shared spaces. So you might have a shared kitchen or a shared living space, but separate apartments or bedrooms for each individual. Again, zoning can be a big barrier to having that kind of option for those who want it, as well as multi-generational housing that's purpose-built to have people of all ages in it. I don't have a slide for universal design today, but the idea that we should be building all housing that has the features that allow anyone to thrive there, regardless of their age. Multi-generational housing is purpose-built with some of those features that allow multiple generations to come together, to connect. Housing with supportive services is a bridge housing solution that can bring together people that have different range of needs so that they can connect with one another, but also the kind of things that can keep them independent, which is important. And I saw at least one person here who works for a home sharing program. As folks were saying hello, and this is a great solution that doesn't require anyone to change anything about where they live. It's actually bringing someone in to your home, and they can help with the costs. They can help with the caregiving potentially. They can help with also the sense of community within the home. And so home sharing programs can help facilitate connecting people. They can create home sharing agreements. They can do a range of things that keep people together. So when you look at those things as a whole, that's a quick speed through look at a range of housing options that can help address the fact that people don't necessarily have the options they need to stay in their communities. And the key part, a key part of our livable communities approach is doing everything we can to help communities build the options they need, to help individuals find the options they need, and to have community partners, leaders, and others take part in creating those options. So to do that, I mentioned AARPs across the country. We're working with partners in industry, home builders, others that can, realtors that can help you build, create, and find the homes you need. We're hoping to educate individuals through a lot of work on our website to share information with folks. But we're also talking to policymakers about the kinds of policies that can be put into place to facilitate these options. So there's lots of things that can be done. And again, back to some of the things that Ruth was talking about, we've got to bring all those groups together to make sure that we've got options that work for everyone and really help facilitate communities that are not isolated and enable people to stay connected. So my final slide here is our future of housing slide. The formatting looks like it got a little bit jumbled up, but we've set up an arp.org/future of housing website, and I'll put all of these websites I mentioned in the chat in a second. But the idea is back to the point about the things we're talking about today not being in isolation. The housing challenges we face are connected to a range of overall trends in the country. So one I'll mention is the advances in technology that are going on, and the idea of technology making it, the builders often talk about the ability to build homes in different ways and the like, but also in this social isolation conversation, we need to talk about connectivity through internet connection. High speed, low cost internet is not universal in this country. There's many places that don't have that. And so we found out during COVID how crucial it can be to connect to healthcare, family members, others through that. So that's one overall trend that makes this important here. The affordability gap, so not having the housing options that meet our needs, is also impacted by the fact that we have a huge affordability crisis across the country, and we'll need to address that. Changing demographics, and we cannot ignore the fact that we're aging as a country. The idea is, or the Census Bureau tells us, that we're going to have more people over the age of 65 than under 18 for the first time by 2034, which means that the issues impacting older adults are not fringe issues. They're the issues that are impacting the bulk of us. When we get to local government influence, the idea that so many things that we touch on here are really governed by local governments. So we can look at national studies, we can think about national solutions, but at the same time, I mentioned all of those housing options that may have local barriers, or you may need local information, or there's very local in nature. So that makes it crucial that we have the kinds of approaches that can be done in different communities across. The environmental conditions aren't really germane to this conversation, but the idea that the mismatch in housing, that we just don't have the right housing that meets our needs, is certainly a crucial part of this conversation. And we just really need to think about housing holistically around all the things it connects to and what it can do for people. And we have to get over the systemic barriers. I must note that all of us do not have the same level of access to communities, whether it's because of someone's race or ability level, income, or their urban or rural nature, other factors. There are often barriers in place that we could get into if we had more time that prevent us from having the options we need. So the idea is that all of these big societal trends are also impacting housing, and we really need to address all of them to try to tackle the needs that we face. And in particular, that we must take a multi-pronged approach to creating the kinds of options that keep people connected, especially as they age, if we're to address social isolation and many of the other health challenges and just the other challenges that can be impacted by having a great place to live. So with that, I'll end my talk and I'll thank you, and I look forward to the Q&A session.
Okay, so for all the panelists, thank you, Rodney. What a wonderful presentation. So I have a few questions to ask. So Ruth, if you don't mind having your camera on, I have a couple of questions, a few questions to ask, and then we're going to try to incorporate the questions that are in the Q&A, answer some of them live in the chat, and then please continue to add questions. And first, we're going to kick off with Ruth. And one of the pieces that I heard, weaving through, there was before pandemic, there's during the pandemic, now in the space that we are with COVID-19, but social isolation has actually, been here. It's not like new since the pandemic. And so I'm really curious, and as part of the work with NeighborWorks and Build Healthy Places Network, co-developing the fact sheet, it was sort of forward-looking about social isolation. And now the Surgeon General has named this as social connection and isolation, particularly isolation and loneliness, as an epidemic. And so I'm curious if you can talk about some of the shifts that you noticed maybe prior to the pandemic and now around social isolation and where we might be headed.
Yeah, for sure. Yeah, I mean, we have to emphasize that point that you said that, COVID did not invent the social isolation. But I think, as you said, it plunged us all into this massive experiment, right? Where we were all made a drastic, widespread change to our lifestyle. And I think we felt that impact of social isolation really quickly. So I think this has spurred a lot of more public knowledge and awareness. And I think our understanding of this work has changed in that we now know that addressing social isolation isn't really an imperative in terms of cost containment for healthcare alone. And Rodney referred to some of the costs that can be associated with social isolation in seniors. So, I mean, I think it means we also know that we have to look beyond medicines and prescriptions to solve this issue. And I think something we've known for centuries is that our housing is a hub of that social connection. So we're seeing ways that healthcare is linking that. And I think the fact that it's mentioned in the Surgeon General's report, as a public health crisis, I think some of the facts that we haven't mentioned, but just some of the physical facts that have come up is that the consequences of poor or insufficient connection include like a 29% increase in risk of heart disease, 32% increased risk of stroke, and a 50% increased risk of developing dementia for older adults. So, I mean, I think, you know, and overall that you get a premature death risk of more than 60%. So, I mean, you can already see the social, the moral, the economical impacts of those kind of things on all of us. And I think we are seeing healthcare systems and public health get more invested in thinking about who else can they work with to address social isolation, where they can partner with local nonprofits partnering with government agencies, and that what you know we know for all the folks on here who are working in housing and housing services, it's really the hub of connecting people and services. There's clearly a role that we can all play in shaping, for those who are shaping the built environment, to connect with those services and programs. So I think if we're going to be addressing the most impacted members of our society, then we have to really be thinking about affordable housing, and that's going to be a nexus of that. And I think we have a lot of people who are connected with community in organizations. And I feel like there's also a sort of elevation of the value of that role in our work. You know, that the people who are doing this work, it's not a nice add-on, but it's really a value. But we can, you know, discuss that more.
If I could jump in here just to follow up on part of that, you know, we had a roundtable a few years ago where we brought in some folks from the health industry, and that's myself and others from the housing side trying to connect and talk about some of these issues. And I remember what a challenge it was to get all those folks at the table, that we spent more than half the day on definitions and the like. And just the idea that Ruth is talking about bringing the groups together to really attack these issues. It's great to see housing being thought of as one of the social determinants of health by the health folks. Of course, from my urban planning background, we always thought that was the case. But you know, I always feel that we need to really come together and focus on that as part of the way to address these problems. So certainly there's progress and ways to go on that as well.
I think that's a great point, Roddy. Sorry, I was just going to say that I say bring these cross sectors together as if that's a simple solution. But the logistics of that, sometimes it feels like international relations. There's acronyms, there's language differences. The same terms can mean different things. So that in itself is a piece of work to collectively work on. I think that's a great point.
Madeline, I wonder if you could jump in and share a little bit more, because when you were sharing, you really illuminated and talked about the ways that you're building networks with residents in building, and then also building networks with partners to meet sort of some of the needs. So I'm hoping you could add a little bit. I saw you shaking your head. Yes, if you can add a little bit more of a flavor there and talk a little bit more about some of the innovations that St. Mary Development Corporation did through COVID and what you're carrying forward in this space of network and partnership.
Yeah, so it's twofold. Obviously, if we run a diabetes program and the people that show up are interested in learning more about diabetes, so obviously they're absorbing information, we're sitting in the room, taking note of who's there, having conversations, but one-on-one, they're identifying, my neighbor's here. I had absolutely no idea that they had diabetes. So they might form, and we've seen this in one of a walk group, because they were all diabetic and needed that healthy exercise. So they formed a walk group on their own. We helped encourage that. Every chance we got, we'd be like, did you know so-and-so is doing the walk group? So not playing matchmaker, if you will, but kind of making those connections. When it comes to community partners, a lot of people that are healthcare, like you said, those language barriers, but they all understand billable. They want to get in the buildings, talk to the seniors, because they can bill. They can benefit from the consumers as they view them. And that's fine, but we're vetting those before they can come in. We'd love to have you talk about this, but let me make sure you understand the population first. If you're going to come and talk about your healthcare facility, I want to know how your doctors are addressing these top 3 health conditions that I know my seniors have. You can come and talk about kidney health. But if you're not touching on some of the new and modern kidney treatments rather than just the old school dialysis, you're doing a disservice to the population. So making sure we're vetting them, making sure that the people really understand who they're serving before they even step foot in our building, but also sharing that data back. So tit for tat. You want to come in and do this, I'm going to give you the opportunity to pitch your program, but I also want to let you know what we're hearing. You know, maybe their outreach and marketing person wants to know why they don't have a lot of people from this zip code. Well, did you realize that there's not a bus that comes out that way? Maybe we can work together, try to find a grant to get some transportation to your facility. So just sharing the resident voices, we've had a lot of success that way. People really understand, you know, this isn't what I think, even if it is, but this is what 1,000 residents are saying. They really can't argue with it. So they just kind of naturally, those that are really interested in making a difference, kind of just naturally take the word of the residents and run with it.
Speaking of residents, I'm wondering if we could jump to one of the questions in the chat was noticing about civil unrest. And Ruth, you really talked about in your presentation about centering belonging and inclusion and civic muscle from Rethink, and that's also a core tenet of the Build Healthy Places Network work. Could you share a little bit more about belonging and what it means in the space of social isolation and what it does for building social connection?
Yeah, I saw that coming too. I thought it's a great point. Looping that back out onto a bigger scale of how are we all feeling disconnected. There are so many, I mean, this is a webinar in itself, right? I mean, and there's so many conversations, connections about the impact of social media and our isolation. But what's come up in the work, and I really respect the folks over at Rethink Health for putting civic muscle and belonging at the center of it, is really sort of thinking, it comes back to that centering resident voices, which is something that we're really thinking about. How does that impact the process that you're doing, the solutions that you end up with, the sustainability of your project or your outcomes, in that you have everyone engaged in what you've chosen. And I think also part of the healing process of those communities that have been perhaps generationally disenfranchised or had negative interactions with perhaps your organization or your sector historically, that by centering belonging and focusing on that kind of healing process, and we just released a framework for racial healing and thinking about this was for healthcare institutions. How do you show up? How do you earn that trust to be able to move forward and create relationships that really are fruitful in advancing your project, but also projects down the line. And they begin to sort of set that sort of tone of inclusion and belonging. And I think, you know, there are so many different ways that can show up, but I thought it came back to sort of Natalie's point of, you know, evaluating by actually referring to, you know, community. I thought that was a great insight, you know, that communities know the solutions and the things that impact them the most. So I think in our work, it shows up in terms of both in practice and, you know, and in principle of not just including, but sometimes deferring to centering community in how we're approaching the work. So how it impacts on a social scale larger than that, I think is definitely another webinar, but I'd invite my panelists to comment.
Rodney or Natalie, do you want to share anything on that? I'm going to move to another question and pulling a thread a little bit more with some of the questions that I'm seeing in the Q&A. Rodney, I'm really curious. You really talked about there isn't a perfect community. There's trade-offs to be made. Some of the questions have noted about nursing home closing or older adults having to leave their home, but then central in all of your conversations was this theme as housing as hub, particularly for social connection. So I'm curious about if you could talk about a little bit more about those tensions and those trade-offs, but then what are some of the opportunities to mitigate or address?
Sure, it's a very complex question, so I'll take a shot at it and we'll follow up as necessary. So first, in terms of the trade-offs, so I mentioned the livability index that I and my team created. You know, we update that thing now. It used to be every 3 years, now it's every year. But one of the things that always strikes me is when we look across, we have 40 different metrics, and we measure some public policies as well in there. When we scale it out of 1 to 100, no community really scores above the high 60s. And the point is that communities that may have a bunch of options may be very expensive, or communities that have some of the features that people need or are far away from anything that people can connect to, or don't have transportation or some of these other things. So there's always something that goes on. Speaking of St. Mary's in Ohio, I remember going to a visit a senior housing complex, two of them in Cleveland years ago, and one was near transit and one was far from transit. I just remember that trade-off that the folks made. The one neighborhood that was near transit was on the east side of Cleveland, I believe, and had you could get to a transit station, but one of the trade-offs was there was high crime in the area. People were afraid to kind of access it. And so if you could get to the transit, you could stay connected, your friends could visit you, or you could stay connected that way, but you had to deal with that. On the other side, we talked to people that were far from transit, they had less connection. They're, again, this is not a medical evaluation, but people seem less connected, they seem less engaged and the like. And so there are trade-offs in every one of the choices we make on where we're going to be and how that can impact us. So to me, to skip just ahead to the solution part, the solution is thinking holistically about the options we have as individuals, thinking about how we make our housing choices and how they might serve us over time. What happens when one thing in our life changes? I talk to many people who've made a housing choice, but something triggers a change, something in their health status or their income or family status shifts, and now all of a sudden that housing option doesn't work for you. Well, you're better off if you thought about it before that crisis moment happens, and now you might be stuck somewhere that doesn't work for you. For policymakers to think ahead about the societal needs, and are we creating enough options that people have, knowing that some of these things happen to people, knowing that someone's physical ability is going to shift, or the spouse is going to die, income issues, what have you, so that people might want another housing option, but be able to stay connected in their communities. We have to think holistically about providing these things that are there. And I mentioned not just the physical piece, but also for the homes, but are we building things in the community? Are we putting the internet access? Are we doing the other things that create these communities holistically that people can stay connected? So, a few thoughts to answer that question. That's a really important one, I think, that you're asking.
I'm just going to jump in, just respond to what Rodney said about, that idea of just pre-planning, so that we have processes and systems in place to take care of when people are aging. Because it does feel sometimes like we act as if aging comes as a bit of a surprise, like, whoa, oh gosh, we've got, more aging people, where it's sort of a natural conclusion of life.
That's right. We're not planning for people of all ages. We just don't have that instinct.
So I'd like to touch on a little bit of that too, because I heard you talk about a couple different things. The trade-off piece is huge, especially with the population that we serve. So you heard me say ours is primarily lower income folks, $14,000 a year. The truth is, if we all live long enough, we're all going to run out of money. So sometimes it's not about options, it's really about what you can afford. We have people come to us all the time that were in their own homes and had a good chunk of money, and then husband got really sick and they had to pay a lot of expenses and medical bills. It's too much for the wife to take care of, and then she ends up in our housing. So sometimes it's really about what you can afford or where you want to be. Like you said, Rodney, you were spot on. The livability index is great. It's something to achieve, something to strive for as a community, to check off those boxes as a policy and government starts looking at how they're going to be able to accommodate the population. But there's a lot of our buildings that would never score well on the livability index. Why? Because they might be in marginalized communities that we've built in the past. Livability, there's no access to grocery stores, there's no access to good quality healthcare, but that was from disinvestment. I mean, in our area alone, we could layer historical redlining maps over top of food deserts, over top of low income, and they're all the same map. The heat markers are exactly the same. Although the livability index is something to strive for, as a housing developer, what we found is in our area, I would say probably 15 minutes away would be perfect to live. But that city, their NIMBYism, there's no way that they would allow us to build affordable housing. There's no way we could get backing from the city to be able to develop within that community. So it is that trade-off. What's the closest to resources as a developer that you can make sure that you're covering the population, and for the barriers or trade-offs, the developer, we look at it as, our priority to try to make sure that we're matching with providers that can provide those services and kind of fill in the gaps, whether it be a mobile grocery that comes to the building because there is no grocery store.
Mhm. And it's great to have those temporary solutions, or not temporary, but kind of one-off solutions to address some of those gaps. And what I'd say to the other part is that this is exactly why it's crucial to have more housing options in high resource communities. But why we need to have in that high income, high resource, whatever the communities they're referring to, that will never allow affordable housing. Well, they should have affordable housing there. They should be zoned for a variety of housing options and not just single family housing on large lots that has always been there. And so that's, to me, it's a twofold approach. One is to create more options in those communities, but also to do things like to help in the communities where housing exists, to create connections to some of the things you're talking about as well. It's not a one size fits all solution, and frankly, we're just short of housing solutions in so many places. There's a lot that we can do to kind of chip away at the big challenge we have, make it a little bit smaller.
And so one of the questions in the chat, because it's not a one size solution, and there's a curiosity around, I think, evidence-based, what can be applied to address social isolation. But there's also this importance about embracing emergence and what's sort of new. And I'm curious if there's some thoughts about the evidence that you have, or in your own work that you're seeing, maybe it's the one-offs that become the next step and start to lead to some thinking about where there could be that could lead to this body of work. It's making a difference with this population. We can test it again. So I'm just curious if there's some emerging evidence around social isolation, or some emergence in your work that you're seeing as a bigger path, moving from one building to two buildings, or moving from one population to the next.
So we can speak to some advancements we've seen. We recognized Wi-Fi was going to be the way to go. People need access. Everything became online. I will say we started putting Wi-Fi in buildings before COVID hit, so we were fortunately a little bit ahead of the game. But we did a survey first. We talked to our residents. We asked them, if you use the internet, what do you use it for? If you don't, why? What are you comfortable with? A tablet, an iPad, what are you looking at? We actually, with AARP initially, we were kind of inspired by the Connect to Effect program you guys had, where we put Wi-Fi in the buildings, and then we gave our residents Alexa devices. Because voice is way easier. You don't have to worry about dexterity. You don't have to worry about any of those things. We started tracking on the back end how many people were using it, but we brought in somebody that can actually teach them how to use it. So they set them up for an Alexa. They found out what was important to them. Oh, I have a daughter in California. Okay, well, did you know you can ask Alexa what the weather looks like in California? So when grandma calls her grandkid, she can say, make sure you wear a raincoat today. It's supposed to rain. Even to know it's a little tiny fragment of information, it helped her feel socially connected to her family. So, I mean, there's good and bad. There are some beautiful stories. We've helped residents. We have a resident that we've helped get a Facebook page so she can communicate with her family in Mexico. Because with limited cell phone minutes and possibly a government-assisted telephone, there's no way she's going to be able to talk for very long on 250 minutes a month. But on the other side, more and more, we've had to try to have conversations and trainings about what catfishing is. And those love scams are the hardest to overcome, because even if I recognize as a senior that this person on the opposite side of the screen probably wants my money, they talk to me every day. They ask how my doctor's appointment went. So if I have to send $100 every now and then, it's better than being completely isolated. Even when they see the clear evidence sometimes that it's a scam, they're still attached to that individual. So it's been good and bad. When it comes to digital technology, we didn't want them to be left behind. Social Security during COVID, you could only access online, which even recertifying for your affordable housing, you need a proof of income statement. It was at a necessity, but it's took off more than we thought. I mean, we've got residents listening to podcasts now. With the Alexas, you can check in on your neighbors. So there is something where you can do drop-ins. We've got a couple residents that have set up drop-ins on each other so that if they haven't seen Miss Smith in a few days, they'll drop in and be like, hey, just wanted to check on you. That's perfect because, I mean, we can't go visit every single person and knock on their door every single day if we haven't seen them. It makes them feel that they have that informal support and that there's somebody there that's at least connected to them, even if it's just through their Alexa device.
Rodney, Ruth, anything that you want to lift up or share?
Well, I think those are great advancements. I'll point out too, by the way, though, that we still have a ways to go. That that especially with the Alexa devices and how easy they are to use, the need to memorize the right commands and the like that aren't ideal for older adults either. And so, I think there's also room to move on the kinds of things we can do to make these resources, make these technological advances work for older adults. And that's one other thing that we're looking at as well as a piece of this kind of, again, the holistic approach to these solutions is really important.
Yeah, one of the things I was just going to add is slightly off, but is around advances or innovations in who's involved. For us, we're seeing healthcare systems, health payers get more involved in thinking about place-based investment that can support these kinds of innovations. And I think it was to the point of, was it you, Ronnie, was talking about, oh no, it was you, Natalie, about a certain place and the trade-offs, between having access to groceries or transportation. And one example, ProMedica in Ohio actually invested it from assessing their community health needs assessment, what was needed there, actually invested in a local grocery store that was owned by the healthcare system, but run by a management company in what was an area without access to fresh fruits and vegetables. So, I think in terms of innovation, what we see in our work is just who is beginning to step into this space, being a little bit different, and bringing in that awareness around the importance of social connection, trauma-informed approaches, and all that work into both housing and health and that kind of nexus of the both.
And let me actually take another shot at two things I was thinking about that I got distracted from when you called on me. And that's one is the idea of, again, back to crossing these things and connecting these things. One is from a policy standpoint, we're talking about affordable housing and thinking about some of the things that Helen was saying, that places that use that take into account some of the things we're talking about collectively and focus on it policy-wise. So a lot of communities are using the qualified allocation plans and their low-income housing tax credits to say, look, if there's a place that's connected, if it's near transportation, if it's near parks or libraries or some of the other things, they may very well give additional points to those kind of projects. So again, thinking holistically, and now how can we use this one program to help support some of these other ends and not just be single-minded and focused on just creating as much shelter as possible, but also where is this housing and how is it built and how does that help? The second thing I want to lift up quickly is on the holistic effort front are the communities that are working together. We've got 800 communities in our age-friendly network of age-friendly states and communities. They're basically communities that are looking holistically across a range of issues and how they intersect and interact, and they're adopting some policies. There's been states that have joined, have created multi-sector plans for aging that have looked at, again, at a holistic way of looking at some of these issues and trying to get people from different departments and government agencies to talk together, to connect, to work, to have these goals. So I think for me, the biggest things I'm buoyed by are these efforts that, bringing together these stakeholders from across the different parts of the community or the state or the local or state government to start addressing the issues we're talking about.
And so part of the solutions, what came up with the CDC, the Surgeon General, and their data and the research, and then in the survey we conducted a cross-section of Americans, was that folks who are different, have different access to places where they live, learn, work, and play, experience different outcomes around social isolation. And so there's two questions that are related to what might be some specific strategies around creating social connection opportunities for communities that are for marginalized communities. And so it'd be great to hear from the panelists about the work. And Ruth, you talked about belonging. We talked about centering your resident voice. So curious about how you've built strategies in partnership with to address social connection amongst specific populations.
Amongst specific populations. Yeah, I mean, I think part of that becomes, we have a sort of an equity approach. And one of our tools and resources that I can share about thinking consciously when you are doing your outreach and when you are designing is thinking about who you are not reaching and how you're including or not. And I think it needs a sort of systematic and continual reassessment of the approaches that you're using, because and we've experienced that even in ourselves, in our sort of RFPs, or how we outreach people, how you recruit people, is how are you communicating. Language is an obvious one, but it's where you're recruiting, how you're communicating and connecting with people. And I think that all of that is so important in addressing social isolation, because what you're trying to do is go out of the usual path. What you are trying to do is reach people that are just off that usual path, that want to be able to rejoin that sort of communal sort of living. One of the things that I think another question that came up was around LGBTQ that in aging populations is obviously a challenge. Being able to find housing, this sort of issue of having to go back in the closet as they're aging, to be able to get safe and secure housing. And I think that, there's lots of opportunities for intentional, thoughtful creation and partnerships around that.
Yeah, I like that you brought that up, because we're part of a statewide initiative with the WISE curriculum we talked about, and there's two parts to it: the screenings, which we introduced, but there's also a suicide prevention element to it, where we're making sure that providers are QPR trained. We're also making sure that we're bringing some of these same trainings to the population that we're serving. So we're going to bring in QPR. We're going to bring in implicit bias. We're going to bring in trauma-informed care 101, some lower level, more concept, but it gets the residents talking. It gets them kind of thinking about, okay, now I understand why so-and-so may have had a different perspective of me. Another way that we do that is, like you had said earlier, Dr. Ruth, was arts and culture, or maybe Romy said arts and culture, but the arts and culture piece. So sometimes, obviously, we want to have good, solid educations is kind of our space, but we also bring in stuff for fun too. So maybe they're playing Pokino or bingo. Obviously, those healthcare providers really like to bring that stuff in, and we're going to encourage them. Please do bring in bingo. We'd love to have you give the little spiel about what the benefit is to this senior, but then also play the game. You want to have a Bible study, we'll be more than happy to help you create and post the flyers, just to help kind of facilitate and empower those seniors to kind of get out in the community. We're not opposed to giving them jobs either. If Mr. Smith is bored, clearly bored, he's always in our office. Would you help me today, Mr. Smith? I really could use some help delivering these flyers. Come on, let's do it. So now he's got a sense of purpose. One of the ways we make sure we're reaching everybody is we are disseminating information in multiple forms so that nobody is excluded. We post flyers, obviously, we put it on calendars, but we also use a one-call system. So a lot of people use it at church, or if you have children, it's where you, or your doctor, just calling to remind you that you have an appointment tomorrow at 3. Same thing, only it's a pre-recorded message that's going out to everybody we have a telephone number for in our system, so that if they can't read, there's vision impairments, they're not being excluded. They're getting the information in a way that they need to. And the one call system actually was huge during COVID because simple language barriers like mandated personnel only or only essential workers, that's great. But if the seniors don't understand the language, it doesn't make sense to them. We had a senior turning away her Meals on Wheels because she didn't think they were essential workers and she didn't want to get in trouble. No, no, no. They're essential workers, but she just needed that explanation. One of the biggest flubs, I think, is we had an organization come in to talk about social determinants of health to a community that is very marginalized and very isolated. There's been a lot of disengagement from the community. They came out there and they wanted to talk about social determinants of health and how this can affect. One lady, 5 minutes in, raised her hand and she said, I have no idea what a social determinant of health is. So it's just making sure that we're mindful and that there is sometimes that person there to be able to convey the message in a way that the seniors understand. Rather than just assuming, just because I know what that means doesn't mean that they are. Realistically, 20 years ago, nobody was even saying those words. And they've been out of work potentially for 20 years. So it's just making sure that we're being mindful and truly meeting them where they're at so that we can engage them in organic relationships between each other.
And I'm curious if all of you could, one of the questions is around resources. And so I love both everyone's dropping in resources and in the chat. So please keep dropping. It's fantastic. There's a question if you have simple fact sheets and handouts regarding social isolation that's geared towards older adults or any populations, please drop them in. It's really helpful for us as on the panel as well as everyone in this room together. But curious about ways that you've raised funding to support this work creatively through city, county, state, or through other philanthropic or health partnerships. Just curious, some thoughts that folks, as they're thinking about ways to address social isolation for social connection, that they could receive additional funding support to make that happen.
Your mental health and recovery boards are your friends. Even if you don't want to hire somebody yourself, they do fund a lot of providers within the community. And a lot of those providers are looking for spaces that they can be in around people that they serve. So we had mental health and recovery board funded individuals in some of our buildings, and it got us thinking, this is great, but we have those relationships. So if I am presenting something that's a hard topic, some of them are pretty hard if we're talking about alcohol and medication use, right? Some of those are really hard for people to talk about, for people to acknowledge, but they're going to do it a lot better afterward with a relationship they've established in the community than an individual that they don't know. So we took it on ourselves. Like I said in my presentation, we actually have a person 100% funded by our local Adamus board for that. Ohio Mental Health and Addiction Services, the statewide entity, also has funded us multiple times for various things because of the work we're doing. The beautiful thing about mental health is you don't have to know all that language. They kind of understand, the housing speak, they get that. They understand the social support speak. Where the healthcare providers, it is a very different terminology that needs to be used in order for them to understand how really your partnership affects their bottom line. Nothing against healthcare. It's just you got to keep the power on. So being able to communicate in a way that they understand that it is a challenge, where with the mental health and recovery boards, they get it. They understand.
Thanks, Madeline. So we're almost at time and we have one more question. And so folks in the room, and if you can remember, you all have been working in this space for a while, but what's the first thing somebody would need to do if they wanted to start doing work around addressing social isolation and loneliness in their communities? Who'd like to go first?
I can speak and then I'll be quiet, I promise. Get to know your population, that community voice, that centralized voice. Get to know what they need, get to know what they want. Ask them questions. A lot of times individuals just don't want to rattle the cage, but if you're asking them, some of the quietest ones that never come out are the ones that will write 2 pages of all of their opinions. Get them engaged, and advocate. Once you know what they want, advocate.
Thanks, Madeline.
Yeah, I was going to just piggyback off what Madeline said in terms of asking the community, let's all take a step back and elevate the value of the people in our organizations that have those connections to community and value that role as being central for data gathering, directing our work, pointing us to where we need to advocate, and sort of across our sectors, think about that as an essential and central role that we value, rather than a kind of peripheral activity that we do sometimes, but that can completely center our work. And the second thing I would say is, look, another thing, who else is in the communities that you are working with? Who is working in those communities but is not necessarily in your sector, but you have shared goals that you want to advance? And I think Natalie's already spoken to some of the intersections they've had with health. And then it's about beginning to build those relationships.
Yeah, but building those relationships and coalitions to work and create change is crucial. And part of that is framing this in a way that makes the issues relevant to a wide range of audiences. You saw on my last slide how I tried to talk about all of these different trends that come together to make these issues important. I mean, that kind of approach makes it easier to gather folks together to address it, because there isn't a built-in constituency for social isolation. I mean, the reason we're having this conversation today is frankly because there's not enough people already talking about it. So you have to create that constituency and have more people understand how important it is, how it impacts them and their own interest or their own community or their own bottom line in different ways. I mean, that's why that we did that study on Medicare to show, hey, this is important for the federal government to pay attention to. You know, there's lots of different angles to take, but bringing those folks together and bringing the thoughts together helps. And so I do want to circle back to, I think, where Bruce started us with the frames of thinking about this holistically and thinking about the interconnections. I think that's going to be crucial as well. And the thing I'll add to this is having a long-term approach. But this is not a thing that's going to be solved overnight. I heard Natalie talk about some of the frustrations she's had on places that weren't allowing some of these things to be built, for example. Well, that's not going to change overnight in your community necessarily, but it will somewhere. And then maybe it takes a little longer in your place, a little longer somewhere else. But piece by piece, we can chip away at this to create more options for folks, to create more connectivity, to take away as many of those barriers as we can. And I think we'll be in a lot better place after that.
Well, thank you so much, Rodney, Natalie, and Ruth, and for this opportunity to be on the panel with you all as well. And just to say, to remember that there's not a one-size approach, and that there is certainly evidence, but really centering community is critically important in addressing social isolation for connection. And David.
Thank you, Romy, and thank you, everyone. What a great event. This is fascinating. Time just flew by for me. Appreciate everybody attending. A recording of the webinar will be emailed to all of the registrants. Special thanks to NeighborWorks America for making this webinar series possible and all the work we do with you. And we hope to see you all at our upcoming events. We're having a Solutions for Housing Communications event, live and online in Washington, D.C. on April 3rd. And Brittany posted the event information in the chat. And we'd love to have those of you who are not members of NHC join us at nhc.org. You can't miss the join button in the upper right-hand corner, and there's all kinds of great information there as well. So thank you all very much and have a great day.